our big financial endeavor is our scholarships, where we give $10, $2,500 scholarships each year to 10 of our medical students. Our white coat campaign, where we provide a white coat and a stethoscope to all of our incoming medical students, and our transitions and convocation. And so we really want to own and be a big part of the transitions, the legacy, and the traditions of medicine in the medical school, as well as our coming home campaign, where we do mail boxes of goodies, coffee and chili and jerky and whatnot to our trainees abroad, and hoping to keep New Mexico in the back of their mind. And so just a little bit about the Alumni Association. Our intro, our town hall format is going to be very open, hopefully, and everybody who's on here, it'd be great if you could show your faces and unmute yourself and partake in the conversations. Our goal is to ask Dr. Zaydonis and Dr. McGrew questions, and if we could avoid filibusters and get through as many questions as possible, and therefore limiting each of our individual responses to a couple of minutes, that could be really good. And we can talk about some of the parts of medicine that we might see as community members that are worth discussing, how we might approach academics to best support the community and medicine in New Mexico. And so got a lot of really good questions. Let me start by introducing, of course, our two guests, Dr. Zaydonis and Dr. McGrew. First, Dr. Douglas Zaydonis. He's the Executive Vice President for Health Sciences and the Chief Executive Officer for the health system at the University of New Mexico. And he was formerly at the University of California, San Diego, and has been very heavily involved in strategic planning and health system matters. He's been previously at Yale and Rutgers and UMass, as well as the San Diego. And he's a professor of psychiatry and very interested, obviously, in public health and health concerns and mental illness and addictions and homelessness. And he is showing to be very committed to our values in UNM and New Mexico, and has really emphasized community engagement. And thank you, just a testament to that by being here with us today. Also joining us is Dr. McGrew. She's the interim dean of the UNM School of Medicine and a professor in the Family and Community Medicine Department. And she originally received her MD from Louisiana State University. And she began at the UCSF Department of Family Medicine in 1988. I don't know if I should have said that date. I'm sorry, Martha. You can get after me later. And she's served as our clerkship director, our residency director, and vice chair for education, the associate chair, before becoming the chair of family and community medicine in 2008. And Dr. McGrew served as our executive vice dean since 2015 and currently our interim dean. And so certainly very indebted to you for your numerous years of service to New Mexico medicine and helping chaperone many of us through medical schools. So thank you so much, Dr. McGrew. And so I was hoping that we could have just a couple of introductory remarks from Dr. Zaydonis and Dr. McGrew, and then we'll start with some at-large questions, if that's okay.
I think you're first, Dr. Z.
Okay, great. Well, one, thank you for this opportunity to be able to meet with you this evening. And this is great to see everybody's face. I wish there was a little snow from Dr. Phillips in my backyard so that I'd cool it down a bit. But some of you I've seen in other meetings and many of you not. So this is great to be able to have this opportunity. I've been here since December 1st, and you can imagine COVID's exploding, the opportunity for vaccinations, and I'm so proud of this system. And as Dr. Roybal mentioned, I really do feel a great alignment with my own core values, with the emphasis on diversity, the opportunities for career development. I feel like in my career, I've been able to excel in all the different mission areas. And so in some ways, I've worked all my life to get to this spot, and I'm really excited to be here. As you can see in the background is the high desert. My wife and I bought a home there. We're really loving it and excited. We can't wait till COVID's going away so that we can visit more often. I was in my first big meeting with Dr. McGrew. We were in an auditorium without our masks on, and we were meeting with the Cancer Center and going over some strategic planning and initiatives with them today. And thanks for the comment about the bolo. What my wife says is, all that stuff you wear on the weekend, you can now wear at work. And so she has a brother in Tucson and a brother in Dallas. And over time, I developed a liking for this wear. Another aspect of me is I love music. So I don't know how many musicians we have in here, but if you want to check another side of me, go to Spotify and put my name in. I blend, I grew up classical piano, played in a country rock band, and then more recently, last 15 years, I've been doing more global music where I blend my family's culture. My parents came off the boat from Latvia, Eastern Europe, and so Latvia with Native American and African instruments. Really, this has been an exciting time for me, a lot of listening and learning and meeting a lot of groups. And so I'm looking forward to this group, getting your questions, and also questions that I had in my mind as I was thinking about meeting with you all was, what did you love about your experience at UNM and the School of Medicine? What were some of the highlights? What were some of the lowlights, so that we could also look at things that need to be worked on? And also from afar, and after you've been out of a school, sometimes you have a new perspective. And what might be on your dream list for me to be thinking about as we are all working together? And lastly, I know some of you hang out on the campus already, but some of you don't. And for the ones who don't, what could we do to help you in any way? I've been so impressed with Project Echo, so it could be in an academic way. There could be other ways of having students come and visit. But I'll be curious also, what are ways that we could be supportive for you in your journey? So I think I'm going to stop there. There's always a lot more you can say, but I'm sure the questions will come out. And Martha said, keep it brief. So Martha.
Hi, everybody. I am so excited to see so many of you here. It almost actually brings me to tears to see some of you, because I've known you for lots of your lives. And in fact, a little tidbit I'll give Dr. Zaydonis without violating HIPAA is that I've delivered 3 of your babies on this call. So it's really such a joy to be here and just see everybody here. It almost brings me to tears in some ways, because not only have you been our student and our learner, you're our colleagues now, but more importantly, you're our friends, and you're the people that represent us. I mean, we're sort of there up on our big old hill and whatever with academics, but really you're the people out in the world doing the work that we hope that we gave you an opportunity to learn how to do. And now you know it better than we do. You know what's needed in the community. You are the people who know what's needed. And so I'm really grateful to you. There's so many good things happening where we are. I mean, we just lived through COVID, but incredibly, our physician satisfaction has gone up this year. I think one of the things that we learned is that we all have to be in this together, that you put down all the differences. And when you got to do it for our patients, we just get together and do it for our patients. Our programs are accredited. Sometimes people think about medical students and residents, but we also remember have our health professions programs and our biomedical sciences graduate programs. We're thrilled about our diversity. You know, we are a majority of underrepresented in medicine. We have a lot of work to do on health equity in education, and we have to keep peeling back the layers of the onion skin to learn anti-racism and how we can look through different lenses to see the world, and we're really committed to doing that. You know, I'm going to just call out one person on this, which is Stephanie Tran. And I know when we saw each other, I think we almost cried, huh? I first met Stephanie when she was a simulated student for PBL. She wasn't even in medical school yet, but for like 2 years, she was a simulated student. She came, and then she went to medical school. And that didn't always happen with our simulated students. And so I've been able to follow her now for about 7 million years or something like that, Stephanie. So I'm just so excited. And that's just an example of that. You know, some other good things that are going on. If you've driven by UNM or seen it, we're building a new hospital tower. It's going to be incredible. We're going to have 96 new beds. They're mostly going to be surgical and ICU beds, lab. Our hospital is full. You know, we are post-COVID, we are as full as we were during COVID. Less COVID patients, but more other patients. And our envelope's full. I know so many of you want more access to our clinics and places like that. And Mike Richards is going to be joining us, not tonight, but another time. And we're working to get toward that because we want to be that for you in New Mexico, for those of you who are there. My big news, well, I'll tell you, you know, I'm Southern, he's Latvian, I'm Southern, and he does music. I do quilting and bourbon and tea on the front porch and that sort of thing. So, but the big news for me is that I'm retiring at the end of September. I've been here now 31, maybe a little bit more years, but I have my first grandchild is coming at the end of July. And so I'm going to go be with that kiddo, do a little part-time work, do some traveling, hang out on the Gulf Coast. And, you know, we'll see how little work I do. I'm pretty neurotic, so we'll see about that. But thank you for being who we want in the world. I mean, every one of you should go to bed at night and say, God, I have made a difference in my world. And really, that's all any of us want to do, is we want to know that we've improved the health of New Mexico, first and foremost, creating our workforce. That's what this med school, this School of Medicine was made for. And you are just absolutely the jewels in the crown. So thank you for everything you're doing for us. And I look forward to having your questions, even your tough ones.
I'm sure there's going to be some tough questions, but hopefully a lot of fun along the way.
Yeah.
Nothing as bad as the med school tests. Nothing that'll make you sweat.
Okay. Got it.
So hopefully this is going to be a discussion format, and so everybody, when you get a chance to talk, if you could please introduce yourself to us and start out with what year you graduated School of Medicine and what you're doing right now and what you're working, your specialty, just a little bit about you, because we also want to meet everybody and just know you. So I'm Nathaniel Roybal, class of 2007, first graduating MD PhD class, and I left and did a fellowship in ophthalmology and retina surgery, and now I own my own retina practice in Albuquerque. The next person who I'm going to ask to introduce herself and lead off with a question is Dr. Perata. And so please use your hand raise icon if you want to be called on to either ask a question, contribute. It's obviously a little more technically challenging, but we think that this is a format where we can hear from everybody. And so the comments are not just from Dr. McGrew and Dr. Zaydonis. They raised some good questions for us that we'd like to answer for them along the way. And this is a community discussion. And so hopefully, you know, we have some really great people on the line today. And so we want to hear from all of you, please. And so let's start with Dr. Perata.
Thank you, Dr. Roybal. My name is Alicia Perata. I am class of 2008 and actually spent some time with Dr. Roybal in medical school. I did my undergraduate at New Mexico State in Las Cruces, but otherwise have been at UNM since then. So I'm a semi-lifer, not a lifer, since I started off at NMSU, just like Dr. Roybal. So, I'm currently the Chief of General Internal Medicine and Geriatrics for the University of New Mexico, and I am the current Vice President for the UNM Alumni Association. So thank you all so much for being here again. I see a lot of people I recognize and a lot of new people to this venue. So I'm really excited about this turnout and the discussions that we can have. So I'm going to start with the first question. So as you may know, UNM School of Medicine Alumni Association is a diverse group of MD alumni that wish to be more engaged with the School of Medicine. How do you see us being more involved in the School of Medicine, and what can we do to further the School of Medicine mission?
Who wants to take that first, Doug, you or me?
Either way, go ahead if you.
Well, why don't you start? They can hear your new answers and I'll fill in the rest.
All right. Well, one, I would see this as a dialogue. So for me, some of the things that I've been so impressed with is the humility here and all the amazing work going on. So I would really value your input and advice as we move forward in strengthening the school, maintaining its core values and the cultures that here, but also expanding it. You know, when I hear Dr. Roybal speak about his MD PhD program, I know that's going to be one dream for some people. You know, working in the community and rural areas and underserved areas will be a dream for other people. So I look at you as being advisors to us and helping us with strengthening the programs we have here. We also, I'd really like to see an expansion and growth of our IPE, so the interprofessional education work with our College of Nursing, our College of Population Health. I'd like to see that be a School of Public Health, and also our College of Pharmacy. So for those of you living in New Mexico, we really have a shortage of clinical placements for our College of Nursing, and we're really trying to grow that. And I'd love to see where we have both nursing and physicians together in the work. I'm going to be starting at, right now we're doing some pre-planning, and I see Dr. Romero-Leggett is on the call, and she's one of the people, and Dr. Nina Wallerstein, as well as Lisa Kakari-Stone and Tracy Collins, who's the Secretary of Health. We're putting together a health equity summit this fall. And we really want to change what we do to be even more assertive in that area. And we have research in that area, teaching. So for particularly those of you, and I don't know if there are people who are not from New Mexico on this call, but for the people in New Mexico, you know, we want your advice. We've had meetings recently with the New Mexico Medical Society to try to enhance a partnership, and we're actually creating a new committee. And that was one of our efforts to reach out to docs in the community, whether they graduated from UNM or not, and to enhance some of the partnerships there. So really, for me, this was both listening to your questions, because there's value in just your question that you ask tells me something, as well as our responses. And I see this as an ongoing dialogue and really look forward to more of these.
You know, I will add in some practical things if that's okay. I agree with everything Dr. Zaydonis said. You know, we always need teachers. That's first and foremost in the communities. And I know it has been as hard for you this last year as it's been for us. I mean, it's even been hard at times for us to find placements within our own institution because everybody's been so overwhelmed. So that's, you know, first and foremost, the kinds of things we need. But different committees we have, admissions committees, we would love for our alumni. We have community members of those. I'm going to say philanthropy. Oh my gosh. I just want to say thank you to everybody who's already doing that. But just to belong to our La Tierra Sagrada Society takes like $69 a month. But anything as you think about the med school scholarships for our students, I mean, those are the things that really make a humongous difference in our students' lives, because, you know, we have students, we intentionally take New Mexico students, some who come from underprivileged places. And, you know, sometimes even food security is difficult. So we really appreciate anything with that. Bigger things, advocate for us at the legislature. I mean, my goodness, you know, our expenses at the medical school are mostly tied up in people. We have about 1,100 faculty, School of Medicine only, 1,100 faculty, about 1,200 learners, and 2,500 staff. So we are always wanting that kind of advocacy. You know, I would say that there's so many ways that you could be involved, but I guess I would turn that back to you now and say, you know, okay, we've told you what we want. What is it? What are ways you would like to be more involved at the School of Medicine that we can facilitate for you? I don't know who asked that question or where it came from.
Well, I'm going to feed on what Dr. McGrew just said on just one small item because it's a hot topic right now. We have a terrific rural and urban underserved program, and it's lost its HRSA funding. So we're trying to figure out how to cover it. And I think with Dean McGrew, you know, we can figure out how to cover some of the salary costs, but we won't be able to invent money or invent housing for the students when they go around the state. And I remember, you know, when I was a little punk and I got to hang out with a family doc on one of my rotations and live in his house and listen to him all the time. And that really made a difference for me in my career. And so, you know, some of you might have the ability to be generous or have a friend who could be generous and find placements for our students. But that's a money need that we're looking at right now to keep that program afloat.
Even a room in your house.
A room in your house, or tent space in your yard.
Yeah, I think on that topic, I think it's really great. And I think we do need to spend some time talking about some of the things that we're doing that are working, some of the things that we're proud of, and some of the things that were meaningful to people on this call. And let's hear about some of those because we've all been through the same process. And what is it that's actually working? And very rarely do we get the opportunity to ask a group like this. So let's seize the moment. And I'd love to hear from you things that have worked that were meaningful to you during your medical school and residency training. Anybody?
People are shy. You may actually have to call on people, Dr. Roy Ball.
I know. You know, Dr. Tran and I actually worked in the same research lab a long time ago. And I'd like to hear from her for some of the things because she has been through the entire pipeline. And I'd like to hear from her for things that made a difference for her.
Thank you so much, Dr. Roybal. It's great to see everybody. It's been so long since we've had one of these alumni events, and I'm just so excited to see Dr. McGrew and Dr. Leggett. You played such a transformative role in my education at University of New Mexico for both undergraduate and my medical training. So I'm currently a family medicine physician. I'm living in Los Angeles, and I'm working for Cedars-Sinai medical group here. So I'm in a group private practice. I do full spectrum family medicine outside of OB, but I do gynecology. I also have like a very thriving LGBT practice. So I created a prep clinic for our office for Cedars. And I also do HIV treatment and prevention, as well as transgender, gender affirming care hormone therapy. So we're in the process right here to develop an LGBT clinic to help serve the needs of our community here in Los Angeles. And just everything I'm hearing, the culture, I think those are all the things I miss of Albuquerque, New Mexico so much, in UNM that just made it so special. Just 5 minutes on this town hall already, it's like I'm getting warm and fuzzies and just missing you all in my time there at UNM. And so, you know, I think the pipeline programs are phenomenal. Have to thank Dr. Leggett for all her hard work on that. Definitely came in, you know, when I was a senior year of my high school, and did a bunch of pipeline programs that really gave me the opportunity, especially as a minority student, to, you know, get to see what it was like and to see what kind of health career and explore, and wonderful mentors that just really shepherded me through the whole process, start to finish. So nothing but praise to be said, and just such gratitude. And it's just so wonderful to see everyone here.
Well, I loved your comment. And even if you're out of town, now that we've all learned Zoom can work, there may be able to have mentoring from afar, and your clinical practice sounds really terrific. Some of the specialty you've developed. I got a daughter who lives in Santa Monica, and she works at the West LA VA hospital. And so now I can tell her I know a great doctor for her to go switch to. So
That's right.
Thank you. The VA is not far from me. It's about 10 minutes from where I live. So yes, please.
great.
And Dr. Tran is very humble, and something we're going to shout out in our next magazine as well. And in our shout outs, she was just recognized as LA's top doctor as well. No, no surprise there, but I think just kudos and congratulations, and really thanks, because you did also, take advantage of opportunities, and then were so engaged throughout, and you continue to give back as you went on in your career, which just was really appreciated. So it's just so exciting to see you and everyone else here. It is. We're all getting our warm and fuzzies, like you said. And I'm Val Romero-Leggett, School of Medicine. I'm not even going to say my class. All you guys are like little tiny young people. So I've been here a long time, but happy to see everyone, and thank you.
Dr. Romero-Leggett was a medical student when I got here. I just want to say that, so she can't say her year. Oh, Nate already said mine. Never mind.
I'm sorry, I ruined it.
I don't care, Nate.
I think, but oh my gosh, I don't even remember. Yeah, I was 92.
You were in your pie, or maybe you were past that. Anyway.
There's one more folk I'm going to call on to talk about some of the things that worked, and I hope you're able to lend a voice to this. Dr. Mirza, great friend and from medical school. Haven't seen him other than this photo for many years, and so I'm super excited to hear from him. And he still hasn't aged a bit. He looks like $1 million, and would love to hear from you about some of the things that worked during medical school, and some of the things that might help with community outreach, and also just would love to hear what you're up to right now.
Thank you, Nate. Hey, it's so amazing to see everybody. And Nate might be class of 2007, but really he's class of 2004. His PhD doesn't count for anything. So that's his real class. I see a lot of teachers here, a lot of colleagues and friends here, and my first immense gratitude to Dr. McGrew, who really shepherded us like cats through medical school, and we appreciate that a lot. And I see Dr. Archuleta on the line, who taught me how to change diapers in his clinic, so thank you, sir. I see you're still active in all of the teaching, and I've read articles about you still in the newspaper, so you all have been just dedicated teachers to us for lives, and the examples you've set for us are just absolutely amazing. I still boast about my medical training. I serve I'm at the University of Kansas now as a urologic oncologist. So I do surgical oncology for prostate, bladder, and kidney cancers. I have a very strong educational role with the Dean's Educational Council. I serve as the residency program director. I serve on the board of the Society of Academic Urology, which guides sort of the urological mission, academic mission in the country. So I've taken the legacy of my teachers and hopefully am giving back in some way to mentoring and teaching, developing mentoring programs for underserved students who are trying to get into urology. But there's all sorts of issues and ceilings with that all of you are aware of. For me, medical school was just full of support and love. I never really wanted to be a doctor until I became a doctor. And I think that was because of my medical training and people teaching me how to love my community, love the people around me, how to truly be and sincerely be a helpful person. I came into medical school pretty cocky and conceited, honestly. I was an engineering major in college. I thought everything was going to be easy. And the hard part of medical school was not the academics, and I don't think it is for anybody. I think it's literally learning how to care. And it's an eye-opening experience when you really allow yourself to look at it that way. And I think that is what those experiences, my psychiatry rotation, my rotation with Dr. Archuleta during the summer, those are the things that really opened my eyes into my own shortcomings of character, honestly. And I think it really changed me into a better person throughout my training. And until now, that continues to affect me. You know, I'm a little bit disappointed in myself as far as the School of Medicine goes, because I did my residency at the University of New Mexico in urology. And, you know, I keep in touch with my faculty and I help with the residents mentoring and things like that. And I do the same thing for my university, Northwest University, where I did college. And I never really think of the School of Medicine, like the undergrad side, differently from the graduate side until now. And that I think about it, they're really two separate entities in terms of what we offer and how we lend a hand or support or whatever. So I got the mail today, and Nate's picture and Melinda's picture was on the cover, and I was like, man, Nate. And I showed my wife, I was like, this is why you have twins right here. Nate drew me a map of the Gila on a napkin while we were sitting in the UNM hospital cafeteria. In his past life, he used to be a fireman out there, just freelancing it. So he knows the backcountry quite well. He drew me a picture literally on a napkin, and I followed that map. This is before the days of GPS. And, you know, it was a 10-day long trip with my wife. And 9 months later, we had twin boys, which Dr. Espy, who's not on this call, delivered for us. So there are other mentors who helped out in that effort. So I am rejuvenated by this call, and in whatever effort I can make to be supportive of my school and really isolate in my mind my residency program from my undergrad school, and would be happy to hear whatever the programs are out there, how we can help. I can also, I'll be happy to take the responsibility of my class. I think when we get class specific communications, those may resonate with us more than, you know, general communications we get. So if there is an opportunity to help being like a class representative, everybody remembers me as the punk, much like Dr. Zaydonis said. So I'm sure they'll respond in some way, whether it's kind or not, they'll know who I am. Thank you, everyone. Really, really appreciate you all.
Oh, it's so good to hear from you.
Thank you. We do have one more person who needs to comment on this same thread, same question. Samit Patel, if you could introduce yourself and illuminate us a little bit here, please.
Hi, everyone. My name is Sumi. I actually graduated from University of New Mexico School of Medicine in 2019. I'm currently an internal medicine resident at the University of Arizona in Phoenix, about to be a third year. I actually also was a part of the combined BA/MD program in the class of 2011. And so I have a lot to be thankful for. There's a lot of mentors on this call. Dr. Perata, she actually hooded me. Dr. Valerie Romero-Leggett has been an integral part of my medical training, and Dr. Vigil was a great advisor to me during medical school. And I just wanted to thank everybody here and the School of Medicine for really giving me the opportunity to train at UNM. Coming into residency is a scary thing, and specifically in a pandemic, but with the diversity, the volume, everything that I learned during my third and fourth years of medical school, I was able to completely identify the needs that I needed as a future physician, and take a lot of the stuff that I've learned in medical school and apply it to all of my patients here. And I'm really proud to say that I am a product of UNM, and I will always wholeheartedly say that I'm from there and come back whenever I have the opportunity to do so. I am looking forward to hopefully getting to engage more in the School of Medicine. I know I've been able to do so through a couple of venues, and I've been able to do so through the Alumni Association as well, and I got to thank Erica for that. I hope that we can continue that, or at least increase or bolster the mentoring from a resident standpoint. I think it would be great for me to hear from medical students at UNM who are interested in my program. Things like that would be really helpful. I know going through the residency process has been a difficult time right now, but during the interview season, when it opens back up, hearing from medical students who are interested in my program or the specialties offered would be great.
Awesome. Thank you so much and it's great to hear people from around the country who have trained and doing amazing things in our last three of you. It's incredible. So proud. This is just fantastic. I'm going to change gears into another question, and I'm going to hand the mic over to Brian Etheridge, and he has a question that he would like to pose, and I think it's a good one. He's very involved in the community faculty. I'll let him jump on this.
Well, thank you. Yeah, it's funny to see a bunch of people from the class of 2004. Yeah, cool. Anyway, so I'm Brian Etheridge. I'm a pediatrician in Silver City, New Mexico. I did my medical school training at UNM in my residency in Louisville. And it's kind of funny that I swear I was never coming back to the state of New Mexico, but yet your tax dollars brought me back, and it seems has been a good fit in Silver for the past 14 years. I should, just to kind of answer a couple of the other little questions, I think I was well trained in medical school. A lot of the people that are on this call, Dr. McGrew rotated with you. Dr. Vigil, I think she was still in residency, or my first year or second year resident when I did my sub-I. And I will say that my training prepared me well for residency, and definitely for what I do now in the sticks. As far as now, I should say that, I've had a lot of different roles through the years, Peds Society, other stuff, and I think that my training really prepared me well for all that stuff. I will say that kudos to the faculty through the years in the School of Medicine for answering the phone or taking PALS calls or texts or emails to take care of patients. I mean, it's kind of they have answered my calls in some of my patients' darkest moments to help me get them to where they need to go. So kudos to all of them, or just emails and all the other stuff that I don't think a lot of people realize that how much effort goes in sometimes to caring for a patient, and all the people that are behind the scenes to get it done. So thank you for that. The other quick thing I was just going to say thanks for is that there's been a lot of engagement on the part of the School of Medicine over the past couple of years. So I really appreciate the changes there, Dr. McGrew and everybody that's been involved. So as far as my question, actually, it was somebody else's question, but it fits well within my role. So, and I might modify it just a smidge. So the question is what type of resources can the School of Medicine, provide for alumni practicing in rural communities? And I might expand on that, I'm starting to show my age. Not to say that any of us are getting that, but I've really seen kind of rural medicine change just in the past 14 years that I've been in the community, that our workforce is changing, it's getting older. We're, for lack of better terms, really in trouble. So I think it's a great question. And so, yeah, thank you.
Great. Well, I think it's an important one for this state as well as for others. And it will be interesting to see post-COVID how that impacts people with early retirement. I'm already hearing more of that than one might expect. But when I was in the state of Massachusetts, we developed a lot of programs to connect to the rural physicians through teleconsult, and particularly in my area of psychiatry for child psychiatry access, which is sometimes hard, and also for pregnant women who had depression or addiction in particular. So we have just finished the strategic planning on our telehealth, but it also includes two components that I think would be very relevant for your question. One is the teleconsult. So you have a question, you have a problem, you have an issue, you can get access pretty quickly and call into that and get the support you might need on a case. Another would be a Project Echo program, which I really think should be more prominent in our health system. It's actually very well known globally at 150 places, but if that would be of some support for you also, particularly as we think of communities of doctors. The other topic you mentioned, which is the shortage, within that question you had, we're very concerned about that also. And, when I meet with the governor, I meet with the senators or representatives, they're all asking the same question. And how do we get our students to stay in the state? And that's where I think examples like the rural and urban underserved program would be the kind of thing. And just listening to you, I'm thinking, God, if a student hung out with you for a while, they'd want to join your practice or be in your neighborhood. And if they got to see how you enjoy the life that you're living right there, I think you'll role model for them. And, all of your stories have role models that influenced you. And now it's your turn to influence them. And so I think, I think that would be where it would be mutual. But knowing whether teleconsult would be a good thing, knowing whether the ECHO programs would be helpful, and whether you'd be willing to take students early on, which I think gets them to, think about their roots later and coming back. We're also looking at, can we get more support for the students with their core tuition costs and align it with, serving in the state.
Brian, is there, Dr. Etheridge, I should probably call you, but is there anything?
Sorry, Dr. You've been trying to get me to call you Martha, so
I know.
fair's fair.
I know. I know. Is there anything what could we do better for you?
Oh, well, I mean, I think the teleconsults would be amazing. I didn't know that Dr. Ziedonis said that I think the program in Massachusetts was, I think that has a lot to offer, particularly in child psych and some of the other the issues, that we face with that. So I would anything I can do to advocate for that or push, definitely, I think that'd be valuable.
Some of the specialties, I'll just say real quick, is in peds are so hard even to recruit for in Albuquerque. Like, I think we talked, Brian, about peds rheumatology and, peds endocrinology, and they're very hard to recruit for, but we're working on it.
One of the things that was part of the original question and thoughts of that I think would be really neat to think about is we have our medical students do PI experiences. I got to go to Taos, which was just incredibly valuable for me, working with Dr. Kilgore, amazing. But it'd be really neat to get some boots on the ground as far as our residents who have so much more capability and getting them into the community. And that would be incredible, useful, because they got some great training, and that's the way to get them into the rural places as well, and function as more of a physician, and it could give us more training capacity as well. And so, what are your thoughts on that?
You talking about having the residents go out to the sites?
Yes.
Yes, absolutely. And we do have some funding that will let us do that a little bit. Unfortunately, if they're outside of our hospital and they're residents, their salaries aren't paid, right? That's one of the challenges we struggle with. However, we do have in some particular programs, not many, but the departments pay some resident salaries, and then we have some state funding for some others. So we struggle with that too, Nate, how to actually get the residents out into that practice and have it there, but we hear that from everybody that we want to have more residents. The other thing is we're trying to get more of the sort of needed residencies around New Mexico, and I think now they're through the Primary Care Consortium. There are family medicine residents, I think, in Gallup and we have one that's going to be at Shiprock. I don't know if you know that. The first family medicine residency is going to be at Shiprock. And so there are ways that we can begin to do it. One of the things that needs to change at the federal level is the cap, because unfortunately, if you're a hospital that took residents on rotations for many years, your cap, which is the number you can have there that will be funded, got set. And so there's a lot of, it's not just UNM stuff, but really a lot of state and federal advocacy that needs to help them with that as well. And there's some other sources of funding. Dr. Z, I don't know if you want to talk about anything else with CMS or others, but yeah, you're right. I mean, that would be fantastic.
So I think this is a rich question, and in my chair role and in my being a residency program director role, prior chapters of my life. You know, one where we just started a strategic advisory group with the VA. The VA has 13 CBOCs, all community-based outpatient clinics all over the state. That's one avenue. You can work in a CBOC and get paid through the VA residency funds. We just starting a residency program with the Indian Health Service, the first one in Shiprock, and that could become, you know, I've been talking with IHS leaders, that might just be the beginning of more rollouts. Most universities I've been in go over the cap. If you're really poor, you stay within the cap, but most go outside of the cap. So, and sadly, those rates were set in like the 70s and haven't shifted. So UCSD was labeled as a rural place. I don't think it matches rural, but it still gets the rural rate, as crazy as that might sound. So I've also partnered with other community hospitals and even community agencies that were willing to pay for some of the residents to be in their locations. So, you know, anybody who's I think it's a little bit harder if you're alone, a solo practice or group practice, but some of the larger group practices have even partnered because they thought that, look, if I were in a group practice, I'd be thinking about that might be a good way to recruit people into my group practice. So, you know, I think there are lots of angles on this that it's a really great question that we should digest further. But lots of times we get stuck in boxes and there's so many choices.
Well, thanks so much for contemplating it and continuing to think about it. I agree, it'd be a great way to recruit physicians into these rural practices, and we need another couple more Brian Etheridges in Silver City, I'm sure. So just to let everybody know, we do have some questions on board and on deck, and so we know. I'm just going to call out some names here so you know that we're working on you. Dr. Stogner is going to be next, and then Laura Cook and Albert Kwan after that. So we do see your hand up. We have not forgotten about you. And then also Dr. Archuleta, we know you have some questions, so we're gonna speed it up here a little bit. Dr. Stogner, you had a great comment, also one of our great rural docs and a member on our board. And if you can go ahead, I'm gonna turn the floor over to you, please.
So I'm Linda Stogner. I'm family physician, class of '83, and just is that people able to hear me?
Yes.
Yes.
Okay. Just got me and technology aren't the best of friends. I went ahead and flashed my comment up on the chat room for those people that just kind of want to read through and see where I was going. But Dr. McGrew actually kind of tagged part of it was that she's retiring in September, and I've been practicing now for 35 years and 32 of them here in Estancia, and you know, looking at my exit strategy, as I call it, because people freak out when they hear me say retirement. And so I know that there's several other docs on the call that are looking at that. But at the same time, we don't necessarily want to retire from what it is. I mean, we may want to retire from the position that we're currently holding, but how is the School of Medicine looking at using this workforce or helping us to continue to be part of the workforce for educating students, for serving these underserved populations, some of the rural areas. I mean, I've been a doctor here in Estancia, like I say, 32 years. I have 4 or 5 generation families in my practice. I've been able to do the BAMD admissions committee, alumni, serve my academy, and both at the national and state level, and been a preceptor all the years. But now what happens, I don't have an office for students to come to. I don't have some place for them to rotate through. because I've stepped down. And is the university looking at how are we going to use the folks? And we still have good time in us. Manny is a great example. He's been out of the workforce, back into the workforce, and then out again and still serving. And so what kind of strategies are you guys looking at for us old folks?
Dr. Z, do you want to start, or do you?
Yeah, no, I'm good with starting with this one. Look, when I've been very interested in career development and surveying faculty, and everybody thinks we're special, but really the only group that's different and needs is the senior group. And they're worrying about legacy, and they're worrying about transitions that you've just described. So I think that it's vital that we really put together some plans there. I think, the low-hanging fruit's been the easy stuff so far, where if someone volunteers or if they're, local to the area. But I think your question is so important that we need to think about, because think of all the wisdom in that mind of yours and all the experiences that you have. Now, I'm just thinking out loud, with Dr. Romero-Leggett, with all of the pipeline programs, we need trusted partners in different communities, and they're going to be in different places. They'll be in the library. They're going to be in community centers. So there'll be offices all over. We're talking about doing collaborations with churches and co-location of space like that. So I think there's going to be, again, in a odd way, COVID's opened up our mind to not just doing it in the standard way. But just listening to you, I thought, God, we got to have her on our team to help us put together the plan, which might be self-serving for you, but your voice represents many people. And, a lot of my colleagues, when they've retired, they don't want to just stop. They just don't want to work as hard as they've been. And then they'll end up working as hard as they were anyway, just doing it differently. So, I think this would be another area, because sometimes people want to try something new also, and I had some colleagues who got more creative with their creative writing, and then they worked with students in that space. So anyway, so I think there's a really great question, and sort of easy answers, but we should also look at this in a really thoughtful way and get more information, because this is one of the biggest issues for all academic health centers across the country. And when I was at UMass, we were involved in getting a Sloan grant just focused on people in transition at the end of their career, and allowing more flexibility for part-time work and all kinds of choices that academic health centers don't often allow for. Dean McGrew.
Dr. Stogner, you've been part of our team forever. So I want to say that. And Dr. Ziedonis, something kind of a interesting thing about Dr. Stogner is she was often a doctor on a cruise ship, which was her way of getting away and doing that, which I always found the most fascinating thing, from Estancia to a cruise ship. It was incredible. I think there are probably so many ways to be involved. And I want to answer one question separately, which is the credentialing piece. And I will actually going to hook you up with David Pitcher. He's been working in our medical staff affairs. And I know we actually do credentialings for some folks in other organizations. We don't do the privileging, of course, because that has to be where you practice. But I think, for instance, we do credentialing, and somebody on For First Choice might could say that. So I'm going to connect him with you, Linda, and see if he knows anything about that. The other thing is just having people do primary care. I mean, sometimes we just need people who are doing primary care and taking care of medical students. And so I think there's possibilities for lots of ways that are not just, patient care and teaching and other things that maybe we could do. But it's actually a fascinating question. I mean, it is a workforce in a state that is under workforced that still wants to do some work, and the access is so huge. The need for access is so huge in our community. So Bert Umlin, he was driving up to where am I trying to say?
Rios.
To Rios until just a couple of years ago, doing a half a day a week of clinic up there to help them out. So I think there's probably a lot of ways we can think. And I really love, I'll be gone, but I really love Dr. Ziedonis' idea of having you be part of a group that really thinks about how we can utilize that part of the workforce, because that wisdom and skill and all that. The other person I really want to connect into that is Dr. Teresa Vigil, who is our Assistant Dean for the Office of Medical Student Affairs. I mean, one of the things that I hope to do, and I'm going to actually put the responsibility on her since I'm leaving right now, she doesn't even know it, is for us to get back out in the communities post-COVID, you know, really come to the small towns, drive out, meet with people and find out the kinds of things that people want us to do. We used to do that a lot when we had PI, and then COVID really kind of shut us down with all that. So Dr. Vigil, I don't know if you want to comment about any of that.
I would love that. I like to say that, well, many of the students know that I still consider Las Vegas, New Mexico my home, even though I don't get to go up there that much. I want to get out there and start recruiting, because I was able to participate as a medical student in I was able to participate as a medical student by going back to my hometown 3 times during medical school. So, you know, I think the opportunities are still there, and I think that if we show ourselves to you and show that we're still interested and invested in you as teachers, educators, I think the students would just love that opportunity, and it's really truly an unforgettable part of the whole curriculum. So yeah, that's one of my goals.
Thank you.
So awesome. Dr. Stogner, thank you so much for opening up a very rich area for us, and I'm really excited about that. That's fantastic. Let's move on to the next question, unless there's a pending comment on this. And I wanted to, Laura Cook has a question and comment for us, please.
Can you hear me okay?
Yeah.
So,
hi, Laura.
Hi.
Hi.
Class of 97. My youngest son was born after my first year in medical school. Martha delivered him, and he just had his own baby in Albuquerque. So yeah, my daughter was
grandmother already, Dan.
my daughter was born at the end of my medical school, and she just finished her nursing degree at Texas State. I trained in internal medicine and preventive medicine. I attended the Yale program. I worked in Roswell for several years, and I'm actually in San Diego now at the University of California, San Diego, and I do urgent care with a private group called Sharp-Steele. So I teach at the university, and then I do urgent care to keep making money. The timing was good, because my comment was, why doesn't UNM have some sort of locums program where you could have somebody go to, you know, that you could be part of them and know that we already know UNM, we already know the rural areas, that they could go in and either be an instructor and a teacher, or just a fill-in for somebody who needs a week off in a family practice clinic, or, you know, internal medicine or something like that. So it kind of made me think about that. And then teaching at UCSD, there's obviously been a lot more Zoom sorts of things. And so that was the question I submitted, was just about how Zoom and online is changing things, because in my mind, that actually opens up just so much more rural opportunities, because you could have people that are precepting from, you know, at least kind of going through things and helping people at a distance. You know, an example would be just the other day, I was meeting with soon to be 3rd year medical students, and they were practicing history and physical. And so I was reading and then having them give me back the different parts. And so that would be something that if they're wanted to practice an H&P before they actually did it on rounds, like maybe they could call up an instructor to, you know, give direct feedback, and they don't have to be so close and right away, because it's, you know, you don't have to travel anywhere. You just have to turn on your computer and be available for them. And so those are the sorts of things that I was thinking about.
You know, Laura, it just stimulated me to think that we do have a locums program in the medical group. And I think that's exactly right. What would be incredible would be to have a locums program where you could have somebody go out and take a student with them somewhere to do things. I used to do locums down in Reserve in Catron County, you know, where you can drive to the bar or you can ride your horse and hitch it up, either way down there. And that was a fantastic experience to be able to do that. But those are some great ideas. And you're right, especially now that we can do them on Zoom.
Yeah, and I know we have to worry about resident work hours, but when I was a resident at UCLA, we covered a lot of private practice docs over the weekend, and that really gave them a lot of relief. And so there may be other creative things that could be done, you know, with sensitivity to what I just said. But I also yay San Diego, since I was hanging out there and living there. But
I think you mentioned Yale too, and public
and
health.
Yale.
Trained in public health as well. So.
Oh, I know, we got a lot of common ground. And but I liked your question about Zoom, because I really do think it's changed the world. If you look at, you know, Project Echo, it really was unique and special because it was doing so much in that space before. But now, you know, there'll be a lot more competition in that regard. But I do think, you know, right now we're dealing with the return to campus. And if you've been working in the hospital, you've been working in the hospital. But now we're bringing people into all the other settings. And we are, you know, people are asking different questions. And I do think we're going to have more hybrid models than we did before, where some people are on Zoom and other people are together in a room. And we didn't used to do that. Now, I'm going to share one Zoom experience that I had before. I wanted to bring global experiences to my students, and we couldn't afford to fly them all somewhere. So I set up, maybe 10, 15 years ago, Zoom meetings where we would do case conferences with residents from Greece, from China. You know, we can be ugly Americans since almost everybody knows English in healthcare. And so other than the time zone differences, it was amazing as people would listen to just a different way to look at a problem. And sometimes there were different medicines they hadn't heard of. And sometimes there were, what do you mean you let them go home after 3 days? And where maybe the length of stay was much longer in another country. But I'm sure we're going to have a lot more options for people via the Zoom option now that we've had this crazy past year.
Thank you so much, Dr. Cook. So nice to see your palm trees blowing in the background there. Definitely a little jealous.
They're actually fake. It was just one of those things you could put on.
I love that.
Yeah.
If we could hear from Dr. Albert Kwan, please, and get your comment and question, that would be great.
Thank you. I'm nice to listen to my fellow classmate, Linda Stogner. I'm also a class of 1983. And also, I think Dr. Dion Gallant also on this meeting, and thanks to current president of New Mexico Medical Society also participating. I graduated in 1983. I'm a general surgeon, and I did my residency at Texas Tech. I learned how to do cowboy surgery from there. And I served the Air Force for 7 years. After that, I've been in Clovis since 1993, practicing general surgery, solo practice for many years. I became the medical director for our local hospital, Prince Regional Medical Center, in July. Due to the COVID pandemic, they need somebody who's been around, know enough, and try to help to coordinate all the medical service. I got a question and maybe a proposal. It's very, very difficult to recruit, outcoming residents, graduate to come to small towns. Mm-hmm. And I got a simple request or proposal to the leaders in medical school. Most of the residents will sign up the job opportunity by December, even November. I faced a problem recruiting. By the time you try to look for upcoming graduate, they already signed up the contract somewhere else. My humble proposal is, in the event, whatever specialty need to recruit, have the ambassador, like the alumni, contact respective department chair and come over to the department, have a presentation to the graduating residents. Preferably maybe in August or September, to explain to them how much they need in isolated areas. Right now, I'm a general surgeon. We cannot cover 24/7 call for general surgery here. We got 12 days are open, no coverage. Patients need to be transferred far, far away. Sometimes even, hate to say, to El Paso, and that's not good care. I'm also like my classmate Linda, I'm up to the age that I need to find about how to get the next generation of dedicated doctor to serve underserved areas. I find out a lot of residents not enough exposure of what real medicine is all about. They fear the unknown. For us, we know how to relay the information, what the practice is all about. Nice thing being alumni, I can tell them, well, I graduated from UNM too. I can do it, so could you. The Dr. Z mentioned some got dreams. To me, commitment the day I applied to medical school. I decided to make a difference, to serve in an area, no offense, to a place that nobody wants to go. I've been here 28 years. I enjoy every day of it, every moment, every second of patient care. I was president of the Medical Society before, also governor of the College of Surgeons. Currently, I'm the president of American Society of General Surgeons, and being honored to serve, being a member of the alumni. So I would like to propose, have a line of contact in the event we need, upcoming graduating residents to contact them before they sign up for other offers. The best time may be September, latest October, and that's what I learned. By the time we try to get somebody to come down, they already got offers somewhere else. Thank you for listening. Thank you.
Can I just ask a quick question, Dr. Kwan, that may help with this? Actually, when do we have that residency fair that people can come and, the residents walk around and start to do it, no matter what your resident? Is that?
It was Family and Community Medicine specific, but it was in November.
Okay, I know we used to have one for lots of different organizations and people, but thank you, Dr. Kwan. Those are some really great ideas.
Yeah, I think the focus on the specialty, then generalized open.
Yep.
And that's important.
Yeah.
And I talk about is, focus on the specialty. Like, surgery, they got 5 residents graduating. You talk to 5 of them. Instead of talk to, no offense, open, door life for everything, and they are not paying attention to it. I hate to sound like a commercial recruiter, but that's what it's all about. We need to outdone the commercial recruiter, so the headhunters. We are the good ambassador to tell them what life is all about and what the function, the mission, UNM, I remember right, is to provide good workforce to take care of New Mexico patients. Thank you.
Well, I really appreciate what you said, and I do think you got to plant seeds earlier than September. September might be when they get into contract mode and they start thinking about it, but they have to be dreaming about it a little earlier. So I think the more that a doctor like you can support our RUP program, like if one student could come hang out with you and be down in your area and get to know you, that'll have a bigger impact than anything else. And you'll keep in contact with that person and the contracts. I think also you're a great example of somebody that doesn't usually speak as much, meaning you're a surgeon. So often in the rural areas, we only hear from the family doctor speaking. So it's actually good to also get the specialists who are in a rural area to do that. Because I think they see in the news that rural hospitals are struggling. And so the more hospital-based medical student resident dreamers are not sure whether there's going to be a career going that way. So I do think that's going to be an issue in our state to really support the rural areas. And, you know, that is a front and center question for us. But I would suggest that, you know, projects that we have available for residents and medical students where people get to meet you and hear your story. And I mean, I just am impressed with all the things you've accomplished and the kind of different activities. And people, you know, need to have a dream they can imagine doing. And, you know, my dad was a minister and he had a church in the farmland with farmers, and he also had a church in Bethlehem Steel with the steel workers. So all my colleagues didn't go to college, and they all were married by the time I was just figuring out college. And when my dad died, I went back into the rural area, and it was really just amazing to see how people just stayed there and lived there, and all the wonderful values that I learned from them, including not to trust anyone, but that's a different story. So I think that you raise a lot of important issues. Now we're partnering with the New Mexico Medical Society. They're asking the same question. And they would like to do exactly the same thing. In fact, they proposed the same thing in general. So, you know, there probably are a whole bunch of UNM grads that are also there. And also when you're working in your community, there are probably other people, doctors who didn't go to UNM that could help you in getting people to go into your community. But thank you for the question.
Yeah, thank you, Dr. Kwan. That's an incredible question. And I think the biggest thing for us to remember as alumni is our voice is incredibly powerful when talking to younger trainees. One of the things that brought me back to New Mexico and the underserved retina world in New Mexico was physicians who are on the ground here saying you can do very well and you'll love being in New Mexico. Of course, it was already in my heart, but those words really rang true because it was nice to hear that I would be okay if I came back, you know. And so I think our voice is powerful. I was hoping to call on Dr. Gallant. We've been talking about New Mexico Medical Society here.
Yes, exactly.
Yes, sir. Please
I was
go.
open to do a quick comment on, hi, everybody. Dion Gallant, class of 99 and residency 02. And hi to Martha and hi to everybody, all those wonderful faces I recognize. And this year I am president of Medical Society, and I would love for this year to be the one that we can pull off this residency fair, because I've been in Medical Society now for a number of years, and we have what's called a counselor report where we hear from every county in New Mexico. And I've been in that society for 10 or 20 years, and Albert Kwan's been there for longer, and we can already tell you the counselor report. You go county by county and they say, we need more doctors, we need more doctors, we need more doctors. We don't have this, we don't have that. And there's just this amazing need for every specialty of physician throughout the state. And Medical Society is one of those interesting places where you really do get representatives from everywhere, from every part of the state and every specialty. It's really different in that sense. And they're dying to see residents. So this is the pitch for that potential opportunity. It's October 1 and 2. We already have our annual meeting. It's going to be in person. It's like our, you know, we're coming out of COVID, breathing a sigh of relief, in person, real meeting. And Martha and Dr. Zaydonis, if you can possibly pull off getting some residents, I don't think we'll let them leave alive. Somebody from some community is going to have a contract and is going to sign them to Clovis or Tucumcari, Santa Rosa. We know all the towns. So I hope that can be pulled off. If not this year, then maybe in the future, but certainly that door is always open.
I think we should hope to pair with you because it's something we've been talking about in our planning meetings with the Alumni Association. Let's join forces and make it extra good.
Yeah, thank you. Appreciate it.
Good. Well, and I hope many of you joined the Medical Society, and Dr. Gallant, I didn't even recognize you were on, but it's been great to partner with you, and I look forward to this being successful. And whether or not people join the Medical Society or not, we can still all be partnering on these same common problems. And you know, this REP program could all benefit from all of you helping us get an RPSP, so one of the state funds. And you know, that's something very specific. And you know, we've been only thinking about it for medical students, but after Dr. Royball's question about residents, or whoever asked it, you know, I'm thinking, you know, maybe we could also get some funding support in that regard, because you know, usually where you do your residency is where you're going to stay, but they might stay in Albuquerque, and we're happy that some do that, but it would be great if they were all over the state too.
Well, we're getting towards the end of our allotted time here, and I wanted to make sure that we had some time to point out a few important things. First off, thank you, Dr. McGrew. Dr. Zaydonis, you survived. I don't think you might have broke a little bit of a sweat, but it was a good sweat. And it was super exciting. I mean, just the level of talent on the call, getting to hear everybody's personal stories, incredibly touching. It was amazing. Thank you all. And to hear some of the great things you're doing out around the country was amazing. And so thank you all for taking an evening with us. And obviously we need to do more of this because the community is so important in medicine. And that's what we got a little bit of an opportunity to do tonight, is spend some time in community, and also sharpening our axe a little bit and getting some food for thought and some things to chew on that we can work on for the rest of the year. So thank you, everybody. A couple of folks, if you've seen, we have that alumni town hall, and it has Erica Anderson and also Ashley Salazar. They are just an incredible duo that works so hard on our behalf and on the behalf of students. Thank you so much for helping coordinate this for us. But also worth knowing these two incredible women, because they can be a conduit to all of the people on this phone call. And if you do want to have students in your particular office, you want to mentor, you want to participate in the School of Medicine, these two are the conduit to do that. So thank you, Ashley and Erica, for everything that you do. Thank you so much. And the other thing that we wanted to talk about is, obviously our Alumni Association gives in several ways. So some people give by going to the missions, and that means supporting students and getting them in and mentoring them and calling in. Others go by giving to the mission. And so obviously would like to encourage everybody on this call who's benefited from great UNM School of Medicine education and is serving the world and going to bed with a smile, like Dr. McGrew said, with all the impact you're making, but also to think about it for the generations that are coming, and continuing to give to our scholarships, our scholarship drive, our named scholarships that we're pushing for this year. And so name a scholarship after you or your mom or someone who's really impacted you, and give it to a student potentially in perpetuity. So think about that. We're going to look into these Zoom meetings more because we do get to see people from around the country, which I think is really important, and around our state. Thank you, Dr. Kwan, and all of you from around the state. And the job fair is super exciting, Dr. Gallant. We're going to try to wrestle you down and get that there set up. But does anybody else have any comments? Thank you again for coming, lending your time. There's so many people that would be great to continue to hear from. And if anybody has any closing comments, that'd be a good time.
I just wanted to spend a quick 30 seconds of big thanks and gratitude. Very informative, this call, very inspiring what you're all doing. I put in my cell phone and email contact for those who might have either follow-up information or questions. And I think, this was a great opportunity to meet you all. I'm so impressed. And I'm sure we'll figure out ways to continue meeting and getting your information and your ideas, because they were all terrific. And we're going to need your help on some of the matters that we raised. So we really appreciate it.
Thanks again, everyone, for coming. Just also as an aside, there's several people here who aren't on the council, and that's wonderful. So if you're interested in being a part of the council, please get a hold of Ashley or Erica. You can also email myself or Nate, because we would love to have you more engaged. And you'll also have a survey coming to you, because I thought this was fantastic. And what can we do to make it better and get you back on the call and get more people? So this was really a good boost for me, seeing everybody. And thank you so much.
And stay tuned for our communications. You just got the mail out, which we got, had myself and Dr. Melendez. It's an important piece because of mentoring and how much our voice means to recruiting students back to New Mexico. And in October is our reunion. So please look for our announcements on that, and please come and join us. It's a great way, and we'll have a lot of medical students there for you to talk to, celebrate our awardees, just celebrate New Mexico medicine. I think that's a lot of fun for all of us. So thank you, everybody. I almost hate to say goodbye, but I know you all got lives to live. So we'll wrap it up.
Thanks, Nate.
Thank you. Have a good evening.
Thank you all.
Good night,
Good job, Nate.
everyone.
Night, everybody. Great job, Nate.
Yeah, thank you.